Thank you for the introduction, Martha. Yes, my partners, Rebecca is not feeling great, and Ben had a conflicting meeting. He did say he might try and hop on, but I'll go ahead and kind of introduce them so you're aware of who they are, and they did contribute to this presentation. So Rebecca Weems is an APS resource counselor as well for the elementary levels. And Ben Lakuski is the New Mexico College Career Readiness Bureau Counselor Liaison. And I did work with him in the Rio Rancho district for some time. So he does have experience as an actual school counselor as well. So here's a disclaimer. Because this presentation surrounds some heavy topics to deal with trauma and maybe asking you to reflect on your life, we just want you to know that take care of your needs. Should you need a break, should you need to leave the meeting, that's acceptable. And if you do not want to participate in some of the interactive pieces, you do not have to. So that's just a disclaimer as we go into a heavy topic, but this is very informative, and counselors use these practices daily when working with students. And Ben, since he is now working with the College Career Readiness Bureau, also added a chunk of material related to trauma-informed work in the employment industry altogether, just working outside of a school with adults that have experienced trauma. So here are our objectives for today. We're going to talk about what trauma-informed care is. We're going to discuss what an ACE means and what ACEs are. We're going to talk about practices in education, practices for employers, and a case in collaboration. And then I will share some resources during the conclusion. And so I've been a school counselor for over 11 years now. And what it means to be trauma-informed is what we're going to cover first. And this is data that is actually from the United Way of North Central New Mexico. So in general, a lot of our students carry traumas with them. But in a recent survey done in 2022, a staggering 43% of students in the state of New Mexico were chronically absent, which means missing 10% of the school year. And the attendance is an indicator of other problems, trauma. So the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association declared a national state of an emergency in children's mental health. When we're looking at what trauma is, how it affects our health, how it affects attendance, there's an amazing TED Med talk. So it's like TED Talks, but for medical. And this doctor, her name is Nadine Burke-Harris. She found a correlation in working with children with actual physiological manifestations in the way the DNA reacts to trauma and causes actual physical problems. So trauma does increase a risk for heart disease, stroke, cancer, diabetes, and even Alzheimer's. This doctor, Nadine Burke-Harris, in her TED Med, she talks about noticing a disturbing trend. A lot of kids were being referred to her for ADD, ADHD. And when she did a thorough history of physical and mental health, she found that most patients had experienced severe trauma. And so she noticed something else was going along, something that she missed that was very important. And what she realized is trauma manifests into our overall well-being. And our well-being encompasses our physical being, mental, spiritual, intellectual, social, financial, environmental, and occupational. And she realized a child who has experienced abuse and neglect and a disruptive home environment has experienced enough trauma to already have behavioral health needs. This behavior can manifest and be interpreted as disruptive, depressive, anxious, or aggressive behavior. That brings us to discussing what ACEs are. When you see the acronym ACE, that stands for Adverse Childhood Experiences. And this originated in 1995 in a study. So that was pretty recent to our history, but to a study that was done with the CDC and other healthcare organizations. And they identified 3 specific kinds of adversity that children faced in their home that would cause the manifestation into physical and behavioral. So the 3 ACEs that were defined were physical and emotional abuse, neglect, and household dysfunction. Those are the 3 major ACEs. And this original ACE study resulted in a 10-item questionnaire, which is now used to measure childhood trauma. And data from this measuring tool is used to bring awareness, intervention, resources, and hope. The key findings of dozens of studies of ACEs are, they're common. 64% of US adults report they had experienced at least one type of ACE before the age of 18, and nearly 1 in 6 reported they had experienced 4 or more types of ACEs. And there is a powerful, persistent correlation between the more ACEs experienced and the greater chance of poor health outcomes. So among the 3 different types of ACEs identified, there's sub-identifications. So under abuse, we have physical, emotional, and sexual abuse, neglect, physical and emotional, and household dysfunction, to include living with someone in your household that has a mental illness, an incarcerated relative, a mother who is treated violently, substance abuse, and divorce. There's other adversities that have since been recognized, such as bullying, community violence, natural disasters, being a refugee or experiencing war, or witnessing or experiencing an act of terrorism. So later on in this presentation, we'll get the chance to internally assess our own ACEs, and no one will be required to share any of that information. It's just for our own learning. But we want to talk about right now what ACEs do. And so ACEs can act like toxic stress, which is that fight or flight response in the body. So like revving a car engine that's not going anywhere. That's kind of living in a state of fight or flight can cause this toxic stress, which is known to lead to long-lasting wear and tear on the body and brain, and alternate our DNA to some extent and our behavior. But we can reduce the effects of this toxic stress. There is hope. So for those who have experienced ACEs, there are a range of possible responses to include therapy with mental health professionals, meditation helps, physical exercise, spending time in nature and grounding oneself, and many more. The ideal approach is to prevent the ACEs from happening in the first place. So reducing the sources of stress in people's life by helping them meet their basic needs or providing other services. and also fostering these responsive and healthy relationships between students, teachers, caregivers, and other adults in their life, which can buffer a child from the effects of toxic stress. What does an ACE score mean? Well, it's a 10 questionnaire, and the scores are low risk, which is zero ACEs. Intermediate risk is if you have 1 to 3 adverse experiences of trauma, and then a high risk is 4 or more. So again, the higher your ACE scores, the higher likely you are to have chronic depression, cancer, heart disease, physiological or mental disorders. And that's from having that toxic stress in your childhood. The ACE questionnaire is a simple scoring system that attributes 1 point for each category of adverse childhood experiences. The 10 questions cover the domain of trauma that occurred prior to the age of 18. So when you're answering these questions, you want to think about before the age of 18. Higher scores indicate the increased exposure to trauma, which have been associated with greater negative outcomes. These are the negative outcomes that a higher score can lead to, in addition to those major health issues, lack of physical activity, smoking, alcoholism, drug use, missing work, obesity, diabetes, depression, thoughts of suicide or attempts, STDs, STIs, heart disease, cancer, stroke, COPD, or broken bones. I'm going to ask screen now because I'm looking at my slides, but if anyone is interested in taking the ACE screening, or if you have in the past, you don't have to do it again, but I posted the QR code to take the screening. There's a blue box that says start the quiz. So if you did want to see what your ACE score is out of curiosity or just to do some more self-reflection, you're invited to do so now. You're not required to take this. We're not going to be sharing our results. But if you do want to take a moment, I'll stop talking for a couple of minutes so people can take the ACE screening if they would like. I'm going to take it along with you just to kind of pace time. Okay. I think by now everyone should have completed it if you did want to take it. And it's very interesting. And I think as a parent, I am divorced, I have 2 children. Sometimes when you're in that fog of going through a situation where you're separating in a marriage, you don't realize to what extent this trauma can have impact over your children. And so those are things that I've been reflecting on my own personal ACEs and ACEs that I may have caused my children, and what I could do to help them recover from that. I will disclose, I do have my children in counseling, and I try and have a healthy co-parenting relationship with their father. And I've accepted that this was traumatic for them, and it's going to be something that, is an ACE, but hopefully that's the only one they'll have in their lifetime. But it's interesting to reflect on that as a person, as a parent, and as a counselor. And as a practicing school counselor, we don't give students these kind of quizzes ever. This is something we just kind of make mental notes about as they're disclosing any problems that they would like to share. And in working with children, we have to give informed consent and tell them the limitations of confidentiality, which are, if they are thinking about hurting themselves or someone else, or someone's hurting them, we will have to break confidentiality. So this is not a quiz we give to children, but it is something that we're aware of in our practice and kind of make mental notes about trauma that they've been exposed to. On this slide is a image of the questions that were asked in case anyone didn't open the quiz and see for themselves. And these are all available online. Practices in education. So our stakeholders work together to regulate students and then educate. And by stakeholders, I mean counselors, teachers, administration, daycare workers, anyone who is invested in the child's well-being day to day. And schools, we have the responsibility to provide a free and equitable education to all students. While some come to school ready to learn, others may not. So we need to be aware of that as educators. And schools must fill the gap between where students are and where they need to be, using both academic and social emotional interventions. And as stakeholders, we need to be at the forefront of advocating for our students and their social and emotional needs. Within APS, counselors follow the American School Counseling Association model. So school counselors have a professional association that the majority of us pay membership to for continuing education and for following the profession that's established in a model that was derived from data. So data that shows that it works. And counselors support students in 3 domains: their academic, social, emotional, and college and career readiness. And we provide equitable services to reduce the barriers to learning. And we want to provide a safe space for students to receive support through class lessons, small group, and one-on-one interventions. So school counselors, we never do therapy. We're not therapists. We're not licensed therapists. We're licensed school counselors. So we could do brief solution-focused therapy, but we are not engaging in a therapeutic model, and we're not calling students out for hour-long therapy sessions. We do brief solution-focused therapy because we do need to have our students in their classroom learning, and we do have resources to refer them to therapy if that is a need. So with APS, we do the Child Protection Unit in kindergarten. So that's an early intervention led by a counselor that teaches students what's safe and not safe in their home. Good touch, bad touch, guns, things of that nature are taught in kindergarten to bring that early awareness. So students know they have a voice and they know what's safe and not safe in their home. Kelso's Choice, that's a social emotional learning model that's used as a guided curriculum tool through counselors in elementary school. And Kelso's Choice teaches students soft skills such as anger management, making choices, kindness, etc. And suicide prevention is another counselor-driven initiative. The counselors are required to provide suicide lessons to their students, and we even have additional supports with that. Crossroads Counseling is a substance prevention and intervention program, and PORT is another response that the Crossroads counselors do. So PORT is post-overdose response, the post-overdose response team. So if our students did have a near overdose, we have a plan on how to support that student. But the main objective is prevention and early intervention. So we have Crossroads counselors at all our big comprehensive high schools. And we also have them 4 in middle schools now to build that program even more to have earlier interventions. But all the Crossroads counselors do support the elementary schools as well for prevention lessons. And college and career counseling, that is my domain. We have a team of college and career counselors at every single comprehensive high school to help students set short-term, long-term goals, find their passion, expose them to opportunities, bring in secondary education options for them to explore. And we also support them with their academic planning in high school and post-secondary planning. APS also has school-based health centers that provide medical and professional counseling for students. So that's an option for students at some high schools. And if it's not at their home school site, they're welcome to go to another school that has one. We also have Handle with Care, which is a partnership with our local first responders. And this program is if a student is involved in a traumatic event where the police respond or the firefighters have to respond, they send an email to our APS PD saying this student was involved in a traumatic event. We do not get informed of what happened to the student or any details about the trauma outside of the school. The plan is to be informed that the student was involved in something traumatic so they could be handled with care at school in the days after the event. So if the student shows up to school and is tired, the teacher should have an alert to know why, or if the student doesn't have their supplies. There's just a lot of grace given with the Handle with Care students. And it's not a perfect system with communicating with the first responders and APS PD, but there have been a lot of Handle with Cares this year. And when that happens, the counselor and the teachers are aware, and we monitor the student. And it's simply just monitoring, not calling them out, not embarrassing them, or just handling them with care, exactly what the program's called. Peer Helpers is a suicide prevention program, and it is in 21 APS schools. And that is where students, the student club and organization, to promote suicide awareness and prevention. And we know that students are the peers, and it starts sometimes with students telling their peer they may want to end their life, and teaching the students to know how to react if something like that is said by a peer, who to tell, and how serious to take those comments. DSMART, that is the District Stress Management and Recovery Team. It is a team of counselors that are trained in crisis management and responding. And if there's a student death at a school or a teacher death, a team of DSMART counselors will go to the school to support the students in the days immediately after the event. And we do have health and wellness, and that is weekly meetings to provide support and interventions for students who are exhibiting behavioral and emotional issues. So those are the supports we have for students in the school. Employers, Ben Lukuski put this together from an employer lens to do trauma-informed practices as an employer. Flexible work arrangements help, remote work options, flexible hours, or job sharing opportunities to show employees you value their time, and also to accommodate any ACEs they may have. Career development, providing opportunities for career growth and development training programs, mentorship, career advancement pathways to lead to higher retention rates. So we want our employees to know that they're not in a dead-end situation, that they do have opportunity for growth. Promoting work-life balance. So employers that can offer wellness programs, mental health support, paid time off incentives to help maintain a healthy work-life balance. Meaningful work. Employees do want to feel that their work is meaningful, and employers should communicate their mission and values to help employees feel connected. So finding that sense of belonging and connectedness. Recognition and feedback, providing regular feedback, recognizing employee achievements, and offer rewards for good performance. Also, to support these employees through a trauma-informed lens would be supporting them in being their authentic selves. Not everyone's extroverted or introverted or has the reasons for being what makes them different than everybody else, but honoring that individuality. Providing solid onboarding, development, and growth opportunities, making them feel welcome. Leading with empathy and not assuming their needs or preferences. Demonstrate an impact on society and align value with theirs. Provide creative challenges and stretch assignments. And use flexible communication tools and technology to enhance social interactions. And prioritize mental health and work-life balance. So this case and collaboration is a real story, and it's adjusted to maintain the confidentiality for the student and family involved. This is an actual school counselor case that one of the three of us encountered. And a high school student disclosed to her school counselor she was being sexually abused by her biological father since the age of 12. She was a senior at the time of the disclosure. Her parents are currently married, and she does not want to cause fighting in the home. She has not told her mother out of fear of punishment from her father. Her father is an alcoholic. He's been physically and verbally abusive to her for years. The abuse has impacted her ability to have a normal high school relationship, and there are other children in the household. So when a student's disclosing this, we're not necessarily counting the ACEs, but we are highly aware of the extreme trauma that's going on in this situation and the abuse and legal and law implications that this scenario encompasses. So when this was shared with the school counselor, this is what the school counselor did that day. The school counselor responded with empathy, compassion, reassurance, and validation. Reminder of the informed consent and limits of confidentiality, because that is all stuff that cannot be kept confidential. And counselors are all mandatory reporters. We are mandated to report any abuse and any suspicion of abuse. So that was an immediate CYFD referral. And usually with the CYFD referrals come, counselors inform their administration. their principal. Immediate school police notification. A lot of schools have an unsafe to go home policy. APS has that. So if the student's afraid of going home, we have steps we take in order to support the student. Phone call home to mother. The CYFD social worker and police came to the school pretty much right away to interview the student. CYFD issues an order to remove the abusive parent from the home and have the children removed. The parent complied. And the student was sent to the sexual assault nurse examiner that day and connected with an advocate through the New Mexico Coalition of Sexual Assault Program for counseling. So those were all immediate steps the school counselor has to take. These kind of situations are stop everything and focus on this emergency. And of course, sometimes responding to a traumatic event can create a traumatic experience for the student who obviously her family was just completely upside down with all this information coming out. So continued support was needed and outside counseling was needed to be set up right away. So now that more than ever, and like we saw with that student, she held that in since she was 12 till her senior year. So for years, she went on going to school every day with that kind of stuff going on in her house. And so even though we don't know if a student's experiencing something or not until they say something, we try and treat every student we come into contact as if they experienced trauma, because more than likely they have. Here are some resources, and I am willing to share this, the slides with Martha to share with all of you if anyone's interested. These are all active links for crisis support, for awareness. The TED Talk with Dr. Nadine Burke is linked here, and some resilience and resources for well-being. And I apologize again that my co-presenters could not be here today. These are some pictures of them, and they would be happy to answer any questions anyone has. I'm happy to answer any questions.